recipient of numerous awards and honors, and Professor Sandeep Grover sir, Professor in Department of Psychiatry, PGI Chandigarh, who has a staggering number of more than 900 publications with having been designated with prestigious awards and honors. Our distinguished plenary speaker is Dr. Chetna Duggal, who will speak on where the roads meet, pathways to strengthening community mental health care. We look forward to this thought-provoking session, and now I kindly request our esteemed chairpersons to introduce the presenters for this session.
Well, ladies and gentlemen, it's indeed a pleasure to introduce the esteemed speaker, Dr. Chetna Duggal. She has done her MPhil in clinical psychology from NIMHANS, and she's associate professor, officiating dean, School of Human Ecology at Tata Institute of Social Sciences, Mumbai, a very prestigious institute for social sciences. She's also a trustee of a foundation and a editorial board member and the clinical supervisor. She is recipient of the Mental Health Leadership Award in 2025 at the World Mental Health Congress, and also received some grant from French Embassy, and is a visiting scholar to the Chicago School of Professional Psychology. She had been associated with National Disaster Management Guidelines and Mental Health and Psychosocial Support Services for the Government of India in collaboration with Rahbar from the Tata Institute of Social Sciences. She has co-authored a book, published 20+ journal articles, 11 book chapters, 6 manuals, and other areas of interest, importantly, are the psychotherapy process, training and supervision, reflective practice, child and adolescent mental health, school mental health, suicide prevention. So she has plenty in her pocket to dabble with, you know. So it's a real pleasure to introduce Dr. Chetna Duggal, and I'll request the co-chairperson and my very dear colleague and friend, Dr. Sandeep Grover, to invite her for the talk, please.
It's my pleasure to invite Dr. Chetna Duggal to the dais for her talk. Yeah, thank you.
Thank you, respected chairpersons, for the very warm introduction, and to the organizers who've invited me here, especially Dr. Basu, who extended this invitation to come in and speak about some of the work that we are doing in TIS. It's really exciting also to be in PGI Chandigarh here with all of you, and speak about some of the things that we have been thinking about, and couple of things that I want to say before I start my presentation. First is that this work has evolved over about 8 to 9 years, and I'm going to take you through some of that journey. And it's all work in progress, so we'll be very happy to hear your thoughts and reflections as well, because we continue to shape this work. The other thing that I also want to say at the start is that while I'm here presenting this work belongs to different teams, and you might find that at different places I've tried to put in some team members who have been associated with the projects. While it's not possible to put everyone's name here, but I just want to say that none of this belongs to just one person. A lot of people have co-created this work and shaped it. This area is particularly important for me. I'm going to be talking about two of what we call field action projects in TIS. And this is a very interesting idea. Usually in academic institutions, my sense was when I entered one that we would be required to do teaching, which we do a lot of, and also research, which of course, is very exciting once your PhD is done, because, it gives you sort of a little bit of space to research things that are of interest to you. But this actually requires faculty to also be involved in what is called community outreach. And the idea of community outreach in TIS is also linked to the vision of the institute, which is based on social justice, that how do we as faculty bring alive the vision of TIS by endorsing the value of social justice, reaching out to communities that are more marginalized, who are more economically disadvantaged, and who are in resource-constrained settings. So it gets faculty thinking about how do you go out, figure out and work with communities, create opportunities for social change as well. So the work that we started doing is in the context of the field action projects that TIS requires faculty to start thinking about. And I'll be talking about two field action projects. One is called SIMHA and the other is called Rahbar. So I'll start with SIMHA essentially because this is a field action project that began before Rahbar. So I'll start with that. And this field action project actually began in 2017. At that time, TIS was part of sort of a center of excellence looking at well-being of adolescents and youth. And I was looking at mental health and well-being as one area. And we were essentially supposed to do simple desk reviews, come up with recommendations for what perhaps needs to happen in the sector, and things like that. It was supposed to evolve into some kind of a academic exercise with a book chapter. But at that time, some of the things started standing out for us in terms of the growing number of mental health concerns amongst young people. We knew that depression, anxiety, substance and digital use were increasing, and then of course, the concern around self-harm. Now, of course, if you look at the most recent data, also suicide is being seen as a big public health concern, with one of the being a leading cause of death in young people. So that's what began as an academic exercise. We realized that one of the recommendations that was coming through from all the engagement we were having with stakeholders was about what needs to be done, particularly in school settings, to support young people. So that was happening. Also around that time, the High Court had taken suo motu cognizance of the fact that there were increasing number of suicides that were happening in Kota, and TISS was invited to work with the district magistrate at that time to come up with some recommendations. So I was part of that team, and I had been spending some time, and it was a very transformative experience for me as a faculty, spending those months there trying to understand what was happening in the ecosystem and trying to give recommendations around that. So those were the two sort of critical experiences that shaped some of the early thought for setting up this project. Okay. No? And of course, one of the things that we wanted to do was also to be able to reach out to young people across contexts, because we were very clear that, the moment you bring a very intersectional lens, that young people who are in certain contexts, who might be marginalized, they're more at risk. And therefore, how do we ensure that we are reaching out to them as well? So that was the initial thought process that we had. The other thing that we were looking at is, okay, so are young people really getting the care and the support that they need? And when we started looking across the continuum of care, the NMHS data had just come in. Treatment gap was as high as 80 to 90%. The regular things that we knew about at that time, high stigma, lack of awareness, not seeking help. And this was stuff that we were looking at in 2017, but I'm going to share some of the things that we are seeing now. And when we're talking to young people now, they're still not seeking as much help as we'd like them to. Globally, of course, there was enough data to show us that schools could be a great context to provide support for young people. So we knew globally there was evidence, but how do we set up something like this in our context? So that's when this field action project really came about. We envisioned it as having 3 pillars. One was, of course, capacity building, because where do you start? You really start with building capacities of teachers, school leaders, counselors. Now, of course, we work with different officials, community workers. But do a lot of research in our context to bring the voices of young people forward, and also look at best practices and solutions. And of course, advocacy, that we start advocating for the well-being of young people in different forums. And considering that this is always at this ethos that we work towards policy change and program initiation, but the idea is that the program gets handed over to implementers who are on ground. So the idea was to have sustainable, evidence-informed, mental health-friendly schools in India, and that's something that we've been working on since we started. One of the things that we realized, because we also provide professional training for young therapists. So we have a master's in applied psychology. A lot of young people train with us, go on to become school counselors. And then we also offer a postgraduate diploma program for people who want to work with children and adolescents. So they also work in schools. So they are working professionals who come, they train with us while they are working. And we realized that what is happening actually in practice is that we are ending up providing only specialized care and treatment. We're not looking at school systems holistically, not working with all stakeholders. Also, the other aspects of promoting psychosocial competence, social emotional learning, mental health education and literacy, and first response or psychosocial support is getting mixed. So we brought the focus back on the whole school approach. And the way we've looked at it over the years, and I'll share some of this as we go along, is to look at not just services, and while services is a crucial part of the work that we do, but actually start at the foundational level in terms of creating school safety, school connection, school belongingness, and also building social emotional learning. What we also recognized is that when we provide social emotional learning to children, what tends to happen is that young people, after building a trusting relationship, they want to share more about what's going on in their lives. So the SEL facilitators or teachers or those who are delivering these curriculums, they also become people who have an interface with children and the mental health concerns that they might have, or whatever psychosocial needs that they might have. So moving to mental health education and literacy, but also, most importantly, equipping different stakeholders in schools to be able to acutely identify the needs of young people and also respond effectively became a very important aspect of the work that we were doing, and of course, providing interventions. The other thing that I want to share is that school counseling is a very different kind of work. And when we started working with school counselors, we realized that while we might think that we've had training in counseling and psychotherapy and we go into school contexts, it brings a whole lot of new challenges for us to manage and different kinds of ethical dilemmas. And school counselors themselves sometimes require support as they establish the work in schools that they're doing. So we wanted to also ensure that there's support for school counselors. So we also provide supervision support for school counselors who are working in school settings. So that's how we've tried to integrate this. And the other thing, of course, is apart from being a multi-tiered approach, we're working with all stakeholders. And I will share a little bit more of this as we go along. So over the years, what did we try to do as we started identifying what was required? It all began with creating awareness around mental health. That's an easy place to start. So we started doing mental health awareness and sensitization work. But very quickly, we realized that once we started doing awareness and sensitization, teachers said that, okay, look, I know about all of this, but when a young person comes to me in the classroom or talks to me, then I don't know what to do. And that's what led us to develop a first response training and a manual to go along with that. When we started talking to school counselors, they said that, this whole school approach is fine. I understand it theoretically. What am I supposed to do in the school? Like, what will it look like in my ecosystem? So we prepared a sort of a whole school approach training for school counselors, and we have a manual for that. We also recognize that young people are much more comfortable seeking support with their peers. So the people who they reach out to are actually their peers. And we realized that people who are in the student council, who are part of NSS, they were very, very enthusiastic, and they wanted to actually pick up skills to be able to support their peers. And that's how the peer support work began. So we have a peer support training with a handbook for young people, those who want to take on this peer support role. At the same time, one of the things that we also had more requests for was what was happening in colleges, because the number of concerns around mental health in medical and engineering colleges, across the board, suicide being one of the big concerns, which I will come back to in a bit. We started a well-being ambassador program where colleges could actually nominate a representative who would then be someone who would actually initiate some of this mental health awareness work in college settings. So we have a fellowship that runs where every college can actually nominate a fellow who comes and trains with us. We do a whole year-long fellowship, and we were able to do this with a stipend for a couple of years to actually have colleges with ambassadors who take care of mental health. Over time, we realized that there weren't that many mental health resources, so we started curating and collating a whole bunch of resources for young people. I will come back to the mental health database piece and the school leaders toolkit in just a bit. So our initial work was to put all of this together, because when we started actually reaching out, we realized that there needs to be all of this integrated in one place. One of the other things that happened when we started going to talk to school principals or government agencies, they started telling us that, why don't you just come in and screen all the young people and tell us who all have a mental health problem, and then we will sort it out. And that was a very tricky conversation, right? Because it has many different kinds of implications. And one of the things that we began advocating for is that it's not about screening young people and identifying them and treating them. The approach needs to be to look at what is our system offering for young people. How do we become more mental health friendly? What are we doing to support the mental health of young people? Rather than actually try to do this. The young people will come and they will move out, but the system is something that is going to stay. So this kind of a shift which we had to bring in with school leaders was a very important shift. And one of the things that we've done now is we have a mental health review tool, and schools actually invite us to come and do a review of policies and programs and the kind of systems that they have in place to see that do they have what they need to make a mental health friendly school in the context of India. So this tool is actually very contextually developed. We've been actually rolling it out across the country now. So this is just to give you a glimpse. These manuals are available, and we have certified trainings that we offer from SIMHA for each of these three, for first response and being a peer supporter, and using the whole school approach for school counselors. So we were doing all of this work, and we felt like, okay, things were like coming together. We were able to reach out to different stakeholders. And then we were invited by an existing consortium, which was working with the government of Jharkhand, where JCRT and JEPC, both bodies in Jharkhand, had collaborated with a whole bunch of organizations, which includes Dream a Dream, Quest, KEF, Satwa, and this whole program was being funded by Porticus, and they were working essentially on a whole child development approach. The focus was to actually build social emotional competencies in young people. Of course, we know that young people, particularly those who are coming from marginalized communities, might have very different kinds of adversities that they might have experienced. And how do we ensure that they are able to get the opportunity to thrive? So that was the entire context of the project. The project had been on for some time, and they were providing social emotional competence building. What they recognized at that time was two things. One, that while we were talking about social emotional learning, mental health and well-being was not figuring in the conversations. And two, because of the large adversity that these young people had experienced, facilitators sometimes were not aware in terms of how to respond also to some of this. So during the pandemic particularly, we had been very closely involved in developing trauma-informed approaches to looking at how we can work with young people. So we've, of course, written about this. It's available in the public domain about trauma-informed teaching learning practices. The idea about how trauma impacts the nervous system. What does it mean and look like for young people, especially in classrooms? And how can teachers be trauma-informed and create trauma-informed classrooms? And how can schools overall be trauma-informed is something that we had already been doing. So they invited us to come in initially to engage, but now, of course, we've been working with them for the last 3 years. As part of the consortium, we are actually moving to a 2.0 where we'll be expanding to the entire state with a whole bunch of other organizations. The details of the project, of course, are available and accessible. But really the work made us think about a couple of things. One, how do we work with organizations who are working with young people to build their capacities in becoming trauma-informed? SEL facilitators who are delivering SEL curriculums, how can they be equipped to understand mental health and well-being needs of young people? And then once we start doing these capacity buildings and training, if people need support, where do they go? So we started a helpline for the teachers and SEL facilitators that if there is something that they see in the classroom and they come back and they want to reach out to us and the training is already done, but what do I do now? So we wanted to have ongoing support for them, so we started the helpline. And we also realized that when we went to the schools, there wasn't a consolidated resource on mental health. So we did this for the entire state of Jharkhand, where we brought together all the mental health resources and gave it to the state government and, of course, to all the partner organizations as well. So we developed a very comprehensive resource which included data from DMHP, RKSK, SHWP, all hospitals, private practitioners. So we put all of that together, all the organizations that are working across different areas like violence or substance use, put it all together and handed it over to the state. The other thing that I want to share about is a school leader toolkit that we developed for this project, but the genesis of this actually happened in another project that we were doing in another state. And in that state, we were working essentially to support school counselors. There was a program that was ongoing, and we were supporting them doing regular supervision with school counselors. And one of the things that school counselors spoke about is that leadership buy-in is becoming a bit of a challenge. School leaders or principals are not completely on board, and we were getting one side of the picture that things are not quite working out. Even if you have a school counselor there, they don't have the support that they need to actually be able to do the work. So we said, okay, fine. So the government said that, why don't you do something? You call all the school principals and have a talk with them and tell them that, okay, like this program has to be supported. So we said, okay. So we had about 20, 30 school leaders, or maybe a little bit more, who came in on a particular day. It was a consultative meet, and we told all the government people, there was health, education, WCD, everybody to be there so that we have complete synergy in what we were all saying. And we opened up a conversation. Of course, it was a day when the 10th board results were coming, so the principals were super stressed about, what will be the outcome of those results for their school. And there was this whole moment of relief when, they got all those results. But it was a very eye-opening moment for us because, we started the conversation with the school leaders, talking to them about, what motivates them to work with young people. And so many of them told us that we really enjoy working with young people. These administrative responsibilities have really pulled us down. And when we started talking to them about what's happening with the mental health of their students, they said that, we are super concerned, but sometimes we just don't know what to do. And if there's a child who's coming in with high risk for suicide, or there's substance and there's someone carrying a substance in my school, I'm really myself at a loss about what needs to be done. I don't know what the law is sometimes. I don't know who to call, whether to work with the teacher, whether to work with the parent, what am I supposed to say, So sometimes I just do what is the simplest thing to do. And it really shifted the perspective that we had about the whole situation, very clearly recognizing that this was something that we needed to reimagine. And if we weren't empowering the school leaders, expecting them to make these decisions on the spot with things that even sometimes we might not be so clear about, is too much to expect. So we actually first started working in that particular government system, putting in lots of support for school leaders, that what they need to do for each of these kinds of what we call high risk or crisis situations. And it began like a support space for them to be able to also figure some of this out. And we got a buy-in from health and education to say that, how will you support this? Because one of the concerns was, I might go ahead and do all of this, but what happens after that? So that's what led to the toolkit development, which we then were able to implement in Jharkhand. But the idea behind the work that we've been doing is essentially to strengthen systems. The idea is not to duplicate systems, because there are already lots of existing systems. There are lots of state governments who are strengthening their school program, either through SHWP or through the SCRTs. There is a lot of good work happening. And our idea really was that we don't want to go and implement another program in the same state and try to duplicate that whole process. How do we sit with the government stakeholders, see where are the gaps that are coming in? How do we mobilize all of that? And that's the approach that we've taken working across different states. One of the things that we take a lot of pride in is that we do the training and capacity building in the language that the stakeholders are most comfortable with, so across states. And that I must attribute to the fact that we have a lot of TIS alum across in every place, so we are able to also do some of that work. But the idea also was that when we're trying to strengthen systems, we need to bring information together. So we did a landscape report, and you can actually access this, which looks at all the government initiatives in school mental health that are happening in the country. It's a year old, but it'll give you a sort of a picture, like a holistic picture. This is a report we wrote with Satwa sometime back. And we've also created some M&E frameworks for state governments to start looking at how do you evaluate school health programs or mental health programs, because that's also something which hasn't been done in our context as much. So some key learnings for us have been about co-creating knowledge. We realized that taking a very top-down expert position and going in, saying that here is something you don't know, here is something we're here to deliver, doesn't always actually lead to knowledge transfer. It has to be co-created, it has to be shared. Of course, I have a training in some areas and I'm bringing in something, but the teachers or the leaders, they are working in their context and they are bringing a very nuanced understanding of actually the needs of that context. So how does one actually do that? How do we draw also from collective wisdom in a room? So when 10 people come together, sometimes we think that the responsibility is on us to provide those answers, but we realize that there's amazing problem solving that happens when you put people together in a room. Building connection is extremely, extremely important. We have had so many trainings where the trainer or the speaker and the audience are just not connected. And we know now, as all practitioners, that our nervous system needs to feel safe and connected before any information can actually go from here to there. So how does that get demonstrated? Can I experience it? If I'm able to experience it with you, then I can actually take it back into the classroom. And we know that from psychotherapy, right? Like a client will experience that in the room with us, and then they can, feel that and experience and create that outside. So it was really the same thing that for teachers, they said that, having been here in this space, knowing how it feels, I know what to do now. So sometimes it's not about telling people what to do, but sometimes they're also able to, pick up from some of this. So having proper check-ins, reflective exercises, and most importantly, closing the loop. It's not about just knowledge. It's not just, mental health awareness and sensitization. It's really a lot about thinking about our beliefs, our assumptions, where they've come from, what are the discourses outside, how have we internalized all of that. And also looking at skill and practice, because so many times teachers will say, I know what you're saying, how do I do this? Show it to me, demonstrate it. So what are the strategies that I can use in my classroom? So we got a lot of feedback saying that toolkits you gave us really helped, because we could use that and go right back into the classroom. And most importantly, advocacy, that not everyone will be in a position of power to be able to advocate for themselves. So if a teacher has a concern and I'm going in as a facilitator, where do I need to take it to the next level in the system? How can teachers become advocates for the needs of young people? So we've been also thinking very closely about that. And most importantly, liaising and partnering. We realized that not every project has to be done by ourselves. We have had fantastic partners. We worked with CRY, where we were working in CCIs, where they had their volunteers who actually delivered a resilience program, and we were only supervising them. So we've also been thinking about, like, the idea is not for us to go everywhere and start delivering the program. How do we enable systems? Right now, we are working in Project Uthan, which is happening in UP, where with the NHM in UP, where they're integrating RKSK, DMHP, SHWP, and there's, I think, Telemanas also. So all of these are looking at the entire gamut of services available to adolescents, and we are only coming in to say, okay, where are the critical gaps that you're feeling? That where are the DMHP team really feeling like, okay, we don't know what to do? Where are the RKSK counselors feeling like, okay, we don't know what to do? And we are creating resources for them and training them only for that piece. So some of these very critical partnerships can help strengthen systems. And one of the things we realized was that nobody talks about the self-care of teachers and leaders and all the other stakeholders. And especially in Jharkhand, where we are working, it's become a really important piece that we are trying to bring in communities of practice when we are working with teachers to look at their self-care. Okay, I think I'm doing okay on time. I just want to say that this project has, of course, is evolving in TIS, but this recently became a national health research priority project for ICMR as well. We had expressed interest, and we are now one of the 8 states where a whole intervention package on leader engagement, gatekeeper training, youth engagement, and self-help interventions is being delivered across 8 states in India. And the idea is for us to look at the well-being of school and college students and come up with how does the state, both in terms of health and education, come together and actually ensure that there is a comprehensive response to the mental health of students in our country because of the growing risk for suicide. So this project is underway, and we are hoping by next year the model should also be out. But these resources have been created, and we are now we are working in one district in Maharashtra, in Thane. Okay, so I wanted to spend a lot of time on this, but I think I will spend a little time on this. Because this is a project which is very dear to my heart, and we were working a lot in schools till someone came and told us that, oh, you're doing this work, you're working in all these tier 1 cities, working in all these schools, working with governments. But really, how do you actually reach the last mile, work with most difficult and adverse contexts, and also think about younger children? You're working too much in adolescents, and that I think is also my preference. I work more with adolescents and youth, but they really made us think that, okay, what about younger children? What about mothers who are in very adverse contexts? And we got a learning grant for this, and they said that, this is something that we don't know. Will you take a learning grant to actually figure this out? So in the year of 2022, I spent a lot of my time in Bahraich district in the UP, and I think it was a very, very rare opportunity for us to be able to do this work, and I feel very privileged because I was able to work with the women in 6 villages there. The idea was pretty straightforward, that we are going to be working on building resilience, acknowledging the trauma and adversity in economically disadvantaged communities, and looking at the cascade effect. You work with mothers, work on their resilience, they build more strategies to respond to the childcare demands that they have, and then you will see the impact of that on the resilience of children. So that was the project. We did a lot of groundwork trying to figure out a model of resilience, creating a curriculum, figuring out who in the community will deliver it, because there were different dialects across the villages that we needed to navigate. And we had a 10-session sort of a thing in place. But we realized that it can't be just the mothers. The moment we entered the community, we knew it had to be more. So we worked with the grandmothers, and mothers together, and we also worked with the fathers. So this was in the village. Of course, a lot of people migrate for employment. So it's usually the mothers who are there, along with their mothers-in-law who are looking after the children. And the fathers usually come in based on whatever seasonal requirements are there. So we delivered this across 6 villages with 120 mothers, worked very closely with the Anganwadi workers and the A&M workers and the Asha Didis, got facilitators from the community, And we also recognized how when we did a qualitative evaluation down the line, mothers talking about, one, feeling better emotionally themselves, feeling much more confident to look after their children, and also reporting closer bonds with children. You will notice there are pictures on my deck. They are all taken with permission, and just wanted to also say that. But what we also realized that we have to think about community-based interventions, but they need to be implemented by community leaders. So what we developed was a facilitator manual, and which can be used by Asha Didi, Anganwadi Didi, a community leader in an NGO which has a presence there, because we also had lots of partner NGOs working there who were very keen to take this forward, so we've been able to disseminate that. But there are lots of other interconnected issues, like issues of domestic violence, alcohol use, a lot of vulnerability to accidents and health concerns. So we had to do a lot of liaising with other systems. And I felt like that was something that needs to be integrated. So in the facilitator manual now, we've of course integrated this thing that the facilitator needs to have a very good connection around this. Okay. So just to give you a little quick sort of where we are right now, we've of course wrapped up some of these projects, but working on the suicide prevention project right now, but also looking deeply at the area of transition from school to college, and looking at how do we build resilience and career pathways for young people. So that's a direction that our work is taking right now.
Another about 5 minutes.
5 minutes?
We'll keep some time for question answer session.
Sure. So I'll take you through the work that we've been doing in Rahbar. It wasn't meant to be so lopsided, but I guess I didn't manage time well, but I'll give you a quick snapshot. So this project started in 2019, and I just want to give you a disclaimer that we will be talking a little bit more on trauma and disaster. So if it feels a little uncomfortable, feel free to step out, take a break. But just to quickly say that this work actually began from the idea about supervision, because I was a supervisor supervising other people's work, realizing that there is no training for supervision in our country, and a lot of times supervisors themselves are not equipped to provide psychotherapy supervision. So we did a lot of research, and we had started supporting organizations to develop supervision protocols, and we offer a postgraduate diploma for supervisors to train in TIS in mental health practice. So we started doing that, but our work actually evolved during COVID, when people started providing support to people through helplines and just volunteering. And we saw so many mental health professionals doing it. And we said, okay, we are going to provide pro bono supervision for anybody who is providing support for COVID. So for about a year, 2-3 of us provided pro bono supervision for anybody who wrote to us, individuals, groups, national helplines, state helplines, and we started working with NDMA at that point in time, and developed a training manual in the first wave, and we thought that would be the end of it, but unfortunately we had a very bad second wave, and the manual was used a lot during that time. We did a lot of work during COVID, but actually in 2023, when the Balasore train accident happened, one of our TIS alums reached out to us just a few hours later saying, can you do something? We have so many people, we have a list from the railways, something needs to be done. So we got all our alums and everybody to reach out to the passengers who were on that train, and within about 6 to 8 hours, give feedback to the local organization and the local government in terms of how many people needed psychological assistance, how many needed logistical support and financial support. And then of course we went on to provide trauma-focused therapy to people who were showing trauma responses. I just want to say a couple of things. One is that there is a lot of resource that we have in our community. A lot of people come forward. But when it comes to crisis and disaster work, there is no script. And the experience that they bring from the field also feeds into the knowledge that we have and some of the training and supervision that we do for them. Sometimes when people are working in crisis and disaster response, there is a sense that they are not as committed, or they're not as motivated, or they're taking too many breaks. But we also start recognizing that these are their ways of dealing with what was coming up for them, and having a very safe space for people who work in crisis support allowed them to actually engage with the work in a way that worked for them. And most importantly, we realized when people are working in the field and they're coming with information to us, there's a huge responsibility on us to escalate that and ensure that systems also respond. So we did that a lot during COVID, created escalation protocols, and during Balasore. But the NDMA then invited us to write up the mental health and psychosocial support guidelines. So these guidelines were released in December 2023, and it actually presents a holistic MHPSS model for working in crisis and disasters, and you can access this. Then the NDMA, when the Sikkim floods happened, asked us to actually come in and show how the guidelines can be implemented. Like, you said, okay, education and health can work together. So we actually worked with the state, worked with the 4 district magistrates who were from the districts of Mangan, Gangtok, Pakyong, and Namchi, which were the affected areas. And we worked with the health and the education department. And through the Telemanas counselors, we ran a reverse helpline to reach out to the people who had been affected by the floods. So with that, we also did work with young people. They were going on a break, and we were able to reach out to about 1,000 students, talk to them about strategies that they could use to take care of themselves, because a lot of them had been impacted. And when they came back from the break, we were able to also hear from some of them in terms of if they could use some of those strategies as well. This was the work that was done by the state, honestly. Dr. Sonam and her team in Sikkim did this work. We were only training and supervising. But our role was really to give them a system, because we had already done this in COVID. Okay, so quick check-in. We can catch a breath. And just to say, you can reach out to us. SIMHA has been recognized as a mental health innovation by 100. We're hoping to be able to continue our work. And thank you for listening to me so patiently.
Thank you, Dr. Chetna. Please join us here. Thank you for that informative talk. And in view of the paucity of time, I'll open the session for a few questions. Yeah, sir, please go ahead.
Extremely well given presentation, provoking lots of questions. You started from Kota. Are you associated with ICOL?
ICOL is part of the school where I'm currently located. So we continue that work.
Because that is highly 8 a.m. till 9 p.m. and suicides occur all the time, and you are not there, unlike Telemanas. And what about your experiences in Kota? Do NEET aspirants commit more suicide as compared to IIT aspirants?
Okay, so because my research was in 2017 and it was a government report, that's why I don't have that data up here, and it's also old data, so I'll refrain from commenting on that question. But yeah, I mean, ICOL is located in the School of Human Ecology. We have 2 other field action projects. I've only spoken about the 2 that I anchor.
Regarding well-being ambassadors, did you contact Deepa Padukone for a love life and
No, I haven't worked with love
life and
laugh.
laugh
No, not.
and trauma-informed teaching practices version 2.0. We are looking forward to it. What we can do is to create not only school ambassadors but also mentor-mentee programs which can further sustain them, because once they leave school, you are gone. And another thing which you can inculcate along with your program is tree plantation on school admission, on school living, joining a professional college and living it, because climate problem is going to become worse and worse each and every day. You can just join it.
Absolutely. No, thank you for the great suggestions.
Thank you, sir. Any last question?
I can see my esteemed teacher, Professor R. Srinivas Murthy, sitting there at the last row. Professor Murthy, sir? Sir, any comment you want to make? Okay, thank you. Thank you.
For the ICMR project? No, so for the ICMR, there are 8 states, but they're not all in the south. They are in Assam,
One in East
Delhi,
and Maharashtra
Rajasthan.
and one in UP.
I think we can,
Yeah.
you can have a dialogue with her later. So we will That's okay, Dr. Madhukar? Thank you.